Hey everyone, today we're going to do the HQ challenge number 36 and we're going to talk about intubation and specifically how you know that the tube is in the right place, meaning is it in the trachea and not the esophagus, okay? So all of the following can be used to rule out an esophageal intubation except, all right? So we want to know that the tube is in the trachea, not the esophagus. So if you think about the intubation procedure, as soon as the ET tube is placed, whoever's bagging puts that bag on with an easy cap. That's one of the first things that we look at to see if there is a color change on exhalation. If there is, we make the assumption that it is in the trachea. So that easy cap is colorimetry, all right? Now, we're also looking for chest rise. We could also use capnometry. We could actually put an end-tidal CO2 monitor on there and get an actual number. So we can do that. And we're going to auscultate, right? A 5-point auscultation, upper lobes, the middle lobe lingula, and the epigastric area. And so what we're looking for is bilateral breath sounds and the absence of epigastric sounds. So if all three of those can rule out an esophageal intubation, the exception must be a chest x-ray. And a lot of times people just jump to that a chest x-ray is what we tell to know that we're in the trachea, and that's not what the chest x-ray does. Once you confirm you're in the trachea with auscultation, capnometry, or colorimetry, once you know you're in the trachea, the chest x-ray is to make sure you're within the correct anatomical location in the trachea, 2 to 5 centimeters above the carina. And just to push this home, I have actually seen in clinical practice where a person was intubated, and it was an esophageal intubation, but the patient was lined up so perfectly that you couldn't discern from the chest x-ray that the tube was in the trachea, not the esophagus, okay? So the chest x-ray, only once you know you're in the trachea, the chest x-ray is to confirm that you're in the correct anatomical location within the trachea. Hope this helps. See you soon.